So I want to talk about one of the most common misconceptions when it comes to treatment with neuromodulator, and that is the treatment of the forehead. So we have one muscle in our forehead that goes from our brows up to the top of our head, and that's called the frontalis muscle. When you raise your brows, you're contracting your frontalis muscle, and that's what causes the lines to appear across your forehead. So if you want to have a smoother forehead, what we do is we relax the frontalis muscle. Now that's great, except for patients who have a low set brow to begin with. If your brow is already coming downward, then by treating the lines across your forehead, we're actually keeping the brow in a very low position because you're not going to be able to lift it anymore. And that's going to accentuate that heavy browed look. So it's really not recommended for those patients. What we can do instead is treat the opposing muscle. In other words, treat the muscles that are pulling your brows inward and down. That would be right in here and a little bit to the side of the brow, where this muscle contributes to pulling the outside of the brow downward. All muscles work in opposition. One muscle pulls one way, the other pulls this way. So if your frontalis is now able to pull up and we release the lower muscles, then what we're doing by treating these muscles is allowing your brow to lift because your frontalis muscle takes over. So sometimes we really have to choose between a lifted brow and a smooth forehead. Not everybody is going to be a candidate to treat both of those areas. And that's where an individual consultation makes all the difference.